Neil Ferguson. The UK is set to experience an inevitable surge of fresh COVID infections in the coming weeks as the country prepares to reopen. Boris Johnson has insisted Britons should not be complacent and continue to exercise caution as the coronavirus continues to pose a threat to the vulnerable and the unvaccinated. Despite warnings from the scientific community about maintaining certain precautions to limit the spread of the virus, most regulations will be completely lifted across England from Monday, July 19. But epidemiologist Professor Neil Ferguson told BBC host Andrew Marr it is almost inevitable daily cases of COVID-19 will once again surge to 100,000, with the potential of the daily infections reaching 200,000. Professor Ferguson said, "It's very difficult to say for certain, but I think 100,000 a day is almost inevitable. We've got two things happening next week. We've got the relaxation on Monday, but, significantly, we also have school holidays starting on Thursday. We've seen a lot of transmission between teenagers and that probably those contact rates will tick down. We're in a position," and the sage summary of the modeling last week. The epidemiologist also suggested hospitalization could once again hit 2,000 unless appropriate measures are adopted, with daily infections rates potentially hitting 200,000 in the coming weeks. He continued, "I think it's almost certain we'll get to 1,000 hospitalizations per day. It'll almost certainly get to 100,000 cases a day. The real question is, do we get to double that? Or even higher? That's where the crystal ball starts to fail. We could get to 2,000 hospitalizations a day, 200,000 cases a day, but it's much less certain." Asked about the impact 2,000 hospitalizations would have on the NHS, Professor Ferguson said, "At that sort of level of 2,000 per day, which is roughly half of what we got to before Christmas in the second wave, there you're talking about major disruption of services, cancellations of elective surgeries, and the backlog of the NHS getting longer and longer. It's looking like people being hospitalized now are not as severely ill as back in December and January, and the mortality rate is much, much lower. Still, if you have enough cases, you can still have quite a significant burden on the healthcare system. Estimates have suggested as many as 10 million Britons could be pinged by the NHS Test and Trace app and asked to self-isolate in the coming weeks." The Prime Minister himself was confirmed to have been contacted by the NHS after coming in close contact with Health Secretary Sajid Javid, who tested positive for COVID on Saturday.